Hi, everyone. Thank you for joining our discussion today related to COVID-19 prevention and recovery. From the joint perspective of a physical therapist, myself, who specializes in breathing and posture, and also a physician, Dr. Akasisu, who is a certified functional medicine practitioner.
I'm glad we found a way to connect and have this important conversation.
Absolutely. We wanted to really bring together the physiology and the physics behind lung and immune health. And
Yes. In order to optimize our ability to fight off and recover from COVID-19, we need to support both the immune system and the mechanics of how we're breathing, because these two are dependent on each other and mutually exclusive.
yeah, it seems like one of the biggest questions out there these days is why individuals get really sick and have a difficult time recovering. And from your perspective, why do you think that is? And how can a functional medicine approach address this?
Very good question. As you know, the science about this virus is evolving, so there's no definite answer. But I think patients' baseline level of systemic inflammation in some cases impacts their fatality risk. We know that older patients that have cardiovascular disease, diabetes, hypertension, and cancers are at higher risk to die from COVID-19 due to the cytokine storm, which is an abnormal immune response. And the common denominator of all these chronic diseases that I mentioned is inflammation. I see chronic inflammation even in young people due to their increased levels of stress, the standard American diet, which is inflammatory, and obesity. The second thing is emerging evidence in COVID-19 suggests that the virus might both evade the innate immune system that and also might kill the white blood cells, which have the role to kill the virus. So if the person's immune system has a delayed response and they also have depleted white blood count, and they get exposed to a high viral load, which happens often with the healthcare workers, this can explain why apparently well people get really sick. I also see in my practice people who look good and apparently healthy that have nutritional deficiencies such as zinc, vitamin C, magnesium, vitamin D, to name just a few. And these are important for for the proper function of the immune system. And Heather, 70% of our immune system is in the gut. And therefore, infections and imbalances in our gut microbiome have been shown to be a source of systemic inflammation. There is a microbiome also in the lungs, so it's important to be balanced. In addition, chronic stress, other chronic infections, and nutrient deficiencies can weaken our immune system. And what functional medicine does is it is a systematic approach that looks for the root cause of these diseases using comprehensive testing. In functional medicine, I see the patient as a whole and work to address those imbalances, such as dysbiosis or chronic infections, as early as possible to prevent disease. And in this way, the functional medicine takes a proactive approach to preventing and reversing chronic disease rather than a reactive response of the conventional medicine that treats each ill with one pill. So, talking about lungs and oxygen, do you see any patterns, Heather, with how someone breathes and their posture that may be making them more susceptible to having a hard time recovering or preventing COVID-19?
Yeah, absolutely. The physics of how we breathe and how we move has a really big impact on our immune function. And particularly the flow and the ability to move fluids and waste throughout the system. And that motility is happening in our blood, in our vasculature, our lymphatic system, in our gut, as you just talked about. So we need to have really good flow and motility through all these areas. And a big piece of what's going to drive that is how we breathe and how we move. And how we posture has a really big influence on that. So the amount of excursion and pump that you can generate through your breath and through the movement of your torso and your rib cage is going to drive this motility in all of those areas. It has a lot to do with the pressure differentials. It's really just a pump. And the biggest driver of this pump is our diaphragm. And the way that our diaphragm is going to function as the best pump it can be has to do with how the postural system is set up around your diaphragm. So, are your abdominals working appropriately to position your rib cage in a way that's going to allow your diaphragm to efficiently pump? Do you have any twists or torsions throughout your body, in particular your rib cage, that's going to influence where you're getting ventilation and perfusion? So one of the things that people aren't really aware of is that the body has a natural twist and asymmetry. And this is actually due to the asymmetry of the diaphragm itself, in that the right side of the diaphragm is thicker and more powerful than the left. And it creates this inherent twist. And what that does is that it means that some areas of the rib cage and the lungs are able to ventilate and perfuse more than others. So one of the things that they've noticed with treating people with more far advanced COVID infections is that they are putting these people on their stomach, and they're putting them in that position really because it allows better perfusion ventilation through the posterior aspect of the rib cage and the lungs. So different positions help drain and help improve that circulation. But normally you would just do it on a natural basis if you're breathing and you're moving correctly. So I would say that's probably one of the biggest things that I think your posture and your movement can do to help with your immune health and just your overall health. From your perspective, though, when we think about the physiology, what would you suggest would be like maybe the top 3 things to help address from that perspective and to prevent and to help with recovery?
Yes, so definitely people can be proactive. As you mentioned about working on their posture, they can also start working on foundational things on their own, and work with a functional medicine doctor who can guide them through prevention strategies if they are well, and interventions for immune system and inflammation if they get sick and during their recovery. So the first one will be controlling inflammation, which can be achieved by eating an anti-inflammatory diet, controlling the blood glucose and insulin resistance. Those are things that I measure with blood work, and working on stress, their sleep and exercise. All these aspects are very important for the immune system. Number 2 will be working on healing their gut. In my practice, I do often a comprehensive stool test, which helps me tailor the interventions to the particular imbalance this person has. For example, they might have bacterial, fungal, or parasitic infections that have to be addressed. And then we have a choice to use more gentle herbs for treatment instead of the antibiotics, or we can increase the good bacteria, or take probiotics if they are missing, also healing the gut lining so they can better absorb the nutrients or use digestive enzymes if they are deficient and not breaking down the food properly. And the third will be to strengthen their immune system. And there are the foods and also certain supplements. Vitamin C, for example, it contributes to immune defense and repair mechanisms. It does support cellular functions of both the innate and the adaptive immune system. In supplementation with vitamin C appears to both prevent and treat systemic infections, and it has been used in ICU to treat the COVID-19 infection. Vitamin D, it favorably modulates cellular defense and repair mechanisms and activates the macrophages, reduces the cytokine expression. Zinc is another one of my favorites. It suppresses virus attachment and replication. And zinc deficiencies are common, especially in those populations that are at higher risk for COVID-19 infections. Taking zinc would both prevent viral infections and reduce their severity and duration. And we can also work on the inflammation with fish oil, curcumin, resveratrol. I put all these things together when I work with patients in my consults. For this COVID period, I offer 30-minute consults or longer and give people a 20% discount. And so we can go through all these things that might not be discussed with other practitioners. And so in addition to all these things, what are some exercises that somebody can do that can support their immune system and lung health, Heather?
Yeah, I know. We need to get everybody breathing and moving during this time. My practice, we put together a 6-minute video last month, and it goes through what we consider to be the most important lung health exercise to do at the moment. And what this exercise is really bringing together is it's bringing together the breathing and the postural and the movement elements so that you're really optimizing that pump of the diaphragm. So another element of this exercise is that we are doing toning, some humming during the exercise. And one of the big reasons why we're incorporating this humming and this toning is that it's producing nitric oxide. There was a study recently that showed that humming increases nitric oxide production 15-fold. And nitric oxide is a very potent antimicrobial, antiviral gas or substance that we produce in our sinuses through normal breathing, and it goes down into our lungs. It also helps promote vasodilation. So not only are we going to help kill off any potential invader, but we're also helping with that oxygen delivery and perfusion through the production of nitric oxide. So that's why we added the toning, the humming, but also really being aware of if you're breathing primarily through your nose or your mouth. Nasal breathing is really the primary way that we want to breathe, and because that's what's going to naturally stimulate that nitric oxide production. It also has kind of really important, profound influences on the posture throughout your body, which muscles you're going to be engaging for breathing, pressure differential. So there's a whole other list of reasons to breathe primarily through your nose and not your mouth. But with the context of what we're talking about these days is the nitric oxide is a big one. So what I would suggest is to focus on that with your nasal breathing. We could try that exercise in our video, and we do offer customized, individualized breathing and postural restoration programs. And at the moment, we're doing a lot of these sessions virtually, and we're offering a special right now in that 55-minute virtual session. is $85. So this is quite a big reduction of our normal fees. And then we reopened recently for low risk individuals or people that really need to come in because they're in a lot of pain or having problems. So we're offering them those sessions as well. But we can really accomplish a lot of this training in a virtual format. So I would recommend to consider that if someone wants a more personalized breathing instruction.
That is fascinating, Heather. That sounds like there is a lot to be done.
Yes, absolutely, on both ends.
Exactly. So, in addition to guidance about social distancing, masks, stress reduction, more can be done to support our patients in anticipation of the possibility that they will contact this virus. And this is accomplished by identifying different ways to reduce inflammation, in identifying and addressing their deficiencies in the key nutrients that are central to a healthy, robust immune system, but also optimizing modifiable lifestyle factors in order to improve overall immune function, tissue oxygenation, posture that then modulates the cellular defense and repair mechanism. And it was fascinating to hear about the nitric oxide. So we're both here to help. We're offering more than the conventional system and individualized approaches to you. And so please reach out. Our contact information is on the video. Thank you.
Thank you very much.